Hello, ma'am. We just got the results back for your dog. So if you don't
Okay.
mind, I'm going to take a few minutes, just walk you through it, make sure you know what's kind of going on, make sure you don't have any questions afterwards.
Right.
So starting right off, we have the white blood cell stuff. So we've got the white blood cell count. That's just the amount of white blood cells in your dog. And starting right off, everything looks great on that count. So we can go through the different types of white blood cells. All the counts look normal, the percentages, everything looks good. So starting off, we have the neutrophils. That is the first line of defense for the dog's immune system. It'll react to any inflammation, any bacterial infection. Those are going to be the first ones that you see. And then we have the monocytes. Those are going to come after the neutrophils. They're the second line of defense. They act as a phagocyte, which basically means they're going to take any bad bacteria or viruses in the body, and they're going to work on breaking those down. Then you have the lymphocytes. Those are going to act as an antibody production system. So they're going to produce antibodies that help your dog fight off any bacteria that it may have in the body. Then you have eosinophils. Those are going to work on hypersensitivity reactions, and you're going to see an increase of these if your dog has any allergies or anything like that. But the count here looks normal, so nothing to worry about.
Okay.
Lastly, we have the basophils. Now, these work on immune reactions, and they're going to increase if you have any inflammation of any sort. But like I said before, the count here looks normal, so there's nothing really to worry about. Moving on to the red blood cells. The red blood cell count is right where we want it as well. Again, that's just the amount of red blood cells in your dog's body, and that looks great. Everything's normal. Hemoglobin is the amount of iron in the blood, and that also assists in transporting oxygen, and everything's normal on that count as well, which is something we're going to come across very, very often because your dog is very healthy. The hematocrit number, that is just the amount of red blood cells in the body. That's the volume of the red blood cells. That's normal as well. MCV, MCH, and MCHC are very important to go over. So basically, MCV is the average size of the red blood cell in the body. MCH is the amount of hemoglobin in a certain red blood cell. And then MCHC is the amount of hemoglobin in a group of red blood cells. And as you can see right here, there is a slight decrease in the MCHC.
Okay, so decide what does that mean?
Normally you can see a decrease with the MCHC if your dog has a form of anemia, which is the loss of red blood cells due to either bleeding or parasites or something like that, or you can have a lack of iron in the blood. But seeing as we went through every other red blood cell measurement and it all looked completely normal, I'd say this is nothing to really worry about at this point, since the decrease is so slight, everything else looks healthy. If it gets any worse, we can start taking a look at it, but right now, I'd say it's nothing to worry about.
Okay.
Moving right along, the platelet count is looking great. That's just the amount of platelets in the body, much like the leukocyte count, the white blood cell count, or the red blood cell count. So your dog's blood should be clotting normally whenever it needs to. No problems there. The liver values are something that we can look at next. They're looking great. Everything is within the interval that we want it. The albumin looks good. The ALP, the ALP and the T-bill are tests that look at the liver and the gallbladder based on anything that your dog is going to be excreting through the urine. And everything that we tested for that came back normal as well. So that means the liver and gallbladder are acting as they should, and they're looking great. They're looking healthy. Moving on to the kidneys, they look good as well, as shown by the BUN and the creatinine tests that we've done. The BUN and the creatinine are also tests, much like the ALP and the T-bill, that test the kidney based on what it's excreting. And that means that the kidney is doing everything that it should be doing. The kidneys also produce electrolytes that keep your dog healthy, such as calcium, phosphorus, sodium, and potassium. These all aid in your dog being healthy. They do a bunch of different tasks in the body, and based on the tests that we took of them, they look normal, healthy as well. That means that the kidney is doing what it should and producing everything that it should be producing, which is fantastic. Moving on to the total protein, that's a measurement of the total protein in the blood, and that's normal, so nothing to talk about there. Globulin is something that has three main jobs. There's three types of globulins. So globulin is going to aid in immune response, iron transport, and cell binding. And based on the test that we ran, that is functioning normally as well. Now, the main thing we need to talk about here is the glucose level.
Yeah, about why is that so high?
Here at the clinic, we can usually see a low increase in glucose, and that is due to the dog being excited because obviously it's at the vet, a new environment, there's a lot of exciting things going on. But with an increase in glucose this high, that is probably most usually due to a type of diabetes called diabetes mellitus. And that is a type of diabetes that is caused by the pancreas not producing enough insulin. And so therefore the insulin can't control the amount of glucose in the blood, which obviously leads to problems like increasing glucose.
Okay, so, what do I do about that?
There are injections, insulin injections that we can give the dog, and a vet tech will be here with you shortly to go over any other options that we may have and help you through the injection. Obviously, we'll help you in any way we can. We'll be here with you when you give your first injection just to make sure everything is going smoothly. We'll also have to keep your dog here for a few more hours after the injection is given, just to make sure that everything is running normally, he's reacting well to the shot, and there's no complications that we need to be aware of. But yes, this is absolutely something that we can fix and something that we can treat if given time.
Okay, sounds good. Thank you so much.
Thank you.